There's a proposed merger between systems in Northeast Tennessee and Southwest Virginia. It's the department's responsibility by law to ensure that the proposal will meet a clear and convincing standard. As many of you know, we have declared the application complete as of a few weeks ago. We have additional questions, and we will likely need to request additional information from the parties as the COPA process continues. The department is also currently developing an index, as called for in the rules, that will detail a preventive approach to care and healthier outcomes that the COPA will require. We believe that this COPA process is important for the citizens of Tennessee, and the department is working diligently to fulfill our requirements in a timely and responsive manner throughout this complex process. We're also endeavoring to be as transparent as we possibly can. Many of you will know that almost everything we are in receipt of that's publicly available is on our COPA website, available for you to review. There's also an opportunity on that website to provide comment to us as we make our deliberations and considerations throughout this process. That's in addition to this opportunity and others. We want to thank you again for being here. This is, again, a very important process. As many of you know, it's occurring simultaneously in 2 states. We are also witnessing this process unfold in the neighboring state of Virginia, where the entities that have applied for this state grant of immunity are also endeavoring to do the same. To give you a little bit more of a background on this process and where we stand at this point in time before we go into taking public comments, we'll turn to the Director of the State Health Planning Agency for the Tennessee Department of Health, who is also stewarding this process. And again, everything we do as a part of this process, we are kind of covering new ground. This process has not unfolded before in our state. This is our first application. So let me just take this opportunity to publicly thank Mr. Jeff Aukerman and his team, as well as Ms. Jane Young, our General Counsel, and her team for all the work that they've done in this process. There's a lot of other people to thank that will come later, but I just wanted to acknowledge that today. And again, welcome, and I'll turn it to Jeff.
Thank you, Dr. Dreisner. Again, my name is Jeff Aukerman. I'm the Director of Health Planning for the State Department of Health. And I'm going to give you a little bit of background on the Certificate of Public Advantage process right now and everything we've been working on. So what is a Certificate of Public Advantage? And some of you have seen some of this information before, but a lot of you are new to this, so this is a real opportunity for the department to provide some education to you on all of this. Certificate of Public Advantage, we're calling it a COPA. A COPA is the written approval by the Department of Health that governs a cooperative agreement among 2 or more hospitals or hospital systems. A cooperative agreement may create an anti-competitive environment, in other words, a monopoly, that would normally not be permitted by state and federal antitrust laws. So the purpose of the COPA is to provide immunity to the hospitals that want to cooperate from state and federal antitrust laws, while also providing state active supervision that ensures that the likely benefits to the public outweigh the disadvantages that result from any reduction in competition. The ability to grant a COPA is authorized by Tennessee's Hospital Cooperation Act of 1993, which was amended in 2015 to specifically permit hospital systems to merge. To apply for a COPA, hospitals are required to submit an application to the Department of Health with detailed information and data about their proposed cooperative agreement. Examples of the information that must be submitted include that cooperative agreement itself, plans to integrate services, financial details, a plan of separation, and actually a lot more detail that I won't go into at this moment. And the applicants, as Dr. Dreisner said, have the burden of showing by clear and convincing evidence that the likely benefits of the proposed cooperative agreement outweigh any disadvantages resulting from the loss of competition. So we have before us an application for a COPA from Mountain States Health Alliance and Wellmont Health System. They submitted the application minus certain confidential and competitively sensitive information, and we knew that they were not going to be able to submit that information at their first submission. So they submitted their application for a cooperative agreement to merge on February 16th of this year. The department received access to that confidential and competitively sensitive information on May 17th, 2016, about 3 months later. The state requested additional information required to review the application, including a revised plan of separation. We received that plan of separation on September 9th of this year. And then Commissioner Dreisner, in consultation with our Attorney General, deemed the application complete on September 15th, 2016, so just this month. And this is a visual for those of you who are visual learners that will show basically the timeline. Wellmont was exploring merging with other hospital systems as early as April 2014, as we understand. In November of 2014, as you see below the year one line, the two hospital systems had an initial meeting with regional stakeholders to kind of introduce the idea of a merger. They announced their intent to merge on April 2nd, 2015, and the General Assembly of the State of Tennessee amended the COPA law to permit hospital mergers, and that was effective May 18th, 2015. So here we are now at this point, as I'm talking about, in the process of year two. The department filed its emergency rules. As required by law, the applicants filed their letter of intent with us on September 16th, 2015. January 7th, 2016, they filed their required pre-submission report. And then again, they submitted their partial application on February 16th, 2016. And then it shows the other dates that I've already talked about in submitting, requesting additional information, receiving it, and deeming the application complete. So it's been a really lengthy process overall. The department itself has been actively involved since we received the application back in February of this year. So once the application was deemed complete, a 120-day review period began. We now have 106 days left in order to make a decision. The department will consider the likely benefits and disadvantages of the proposed cooperative agreement to merge. And under the law, our department will deny a COPA application if the likely benefits fail to outweigh by clear and convincing evidence any disadvantages caused by a potential reduction in competition. And this is another visual showing it's just basically weighing the benefits versus the disadvantages. And we've listed potential benefits and potential disadvantages here. I won't go through these. You can read them as probably more quickly than I can say them. If a COPA application is approved, the Department of Health will provide active supervision to protect the public and to assure that the reduction in healthcare services competition continues to be outweighed by the evidence of benefits, including improvements in health in the service area, healthcare cost, and access to services. Dr. Dreisner mentioned the COPA Index. I want to talk a little bit about that. Under the law, an index will be created should a COPA be granted and used for the department to evaluate the proposed and continuing public advantage of the COPA. The department will set a baseline score and ranges for that score to determine whether the advantage is clear and convincing and remains clear and convincing over time. The index score would be reported on a regular basis. If the advantage is not evident, that's when the department may either renegotiate with the parties or terminate the COPA. And the merge system would then have, under the termination, would then have to complete the plan of separation that's required by law to be filed with us. I want to tell you a little bit about that index advisory group. It's a group of citizens representing Northeast Tennessee because that's the geographic service area for this proposed merger. They were appointed by Commissioner Dreisner. They recommended measures to be considered for an index for the department to use to track the impact should a COPA be granted. And this index advisory group represents community concerns. And the goal is for the department to have a clear and well-defined index that can be easily understood by the hospital systems, the industry stakeholders, and the general public. This group did not make a recommendation on whether to approve the COPA. That's not their charge under the law. Here's a list of the names of those individuals. You may know some of them. And again, I'm not going to read their names off individually, but you can glance through them. And all of this information is online, by the way, on the website of the Department of Health. The advisory group had a number of listening sessions. Actually, they had 4. And their goal was to figure out what measures they would recommend to be included in an index and what outcomes mattered to them if a COPA was issued. They heard from the general community 2 times, from internal stakeholders 1 time, and from external stakeholders, competitors, at another. And then at the 5th meeting, they presented their proposed measures. Now, we are in the middle of our public hearing schedule. We actually set the first one, June 7th in Blumpville, because we thought that we would have had a completed application, and that would have been the date under the law and the rules that we were required to hold at least one public hearing. We held that, and then we realized we didn't have a completed application, and we needed to revise that schedule, and we decided to hold at least 3 others in the general area, Upper East Tennessee, and 1 in Nashville. And that's the one we're at today, September 29th. And the reason we're holding 1 in Nashville is because our COPA statute, unlike the one in Virginia, it covers the entire state. The question is, should this COPA be issued? Commissioner Dreisner and the Department of Health staff are here to listen. Speakers will be called from the sign-up sheet. If you haven't signed up, please go back over to that table and sign up. We have been providing speakers 3 to 5 minutes. At this moment, I think we only have 6 people scheduled to speak. We will be a little bit more lenient than 3 to 5 minutes. However, Allison Rajaratnam is going to be our timekeeper up there, and she will be able to hold up a sign that you can see when we think your time limit is up. We want everyone to be courteous to everyone else. If for any reason we ask you to stop speaking and there's time at the end of this process, you're going to be more than welcome to come back up and speak again. You can send your comments to us via email, mail, or online, and here's the information for that. I want to remind you the session is being video recorded and transcribed. And so here's a good question. How will we use your comments? Well, we've actually used comments we've received previously to form questions that we've asked the applicants. Your comments are going to help us be aware of potential benefits and potential disadvantages that we may not have otherwise considered. And again, your comments today may help us form additional questions to ask the applicants, because even though the application is complete, we do have the ability, and we've told the applicants we have the need to receive some additional information, and they're expecting that from us. So I want to thank you for your patience while I went through this PowerPoint presentation. And now with a little bit of logistics, I'm going to move the podium so that you all will be facing Dr. Dreisner, Mrs. Rajaratnam, and myself when you give your comments.
The first speaker is Courtney Perry.
Thank you, Jeff. Courtney Perry with Amerigroup Tennessee, and I appeared at the hearing in Blumpville back in June, and want to stand by those comments and reiterate one comment I made at the June public hearing. And the original application where it addressed how they would monitor the increase in rates on the commercial side had a footnote and said that this did not apply to Medicaid and Medicare because those rates are non-negotiable. And that is not correct for Amerigroup of Tennessee and the 2 hospitals. We do negotiate rates, and we urge if the application is granted, there is a mechanism to monitor rates as often as found anytime there's a monopoly. And so we would urge that. And my good friend Dick Lodge with Bassberry and Sims tells me in this mountain of paper they might have addressed that issue. I have not been able to find it. I did review the response to the, I believe, the April 22nd questions, and the way I read them, I think on page 6, it was consistent with the application that the monitoring of rates did not apply to Medicare and Medicaid, and we think that's a real problem. I think I'm well below my 3 to 5 minutes, and I appreciate the time. And I'm not being disrespectful to the other speakers, but I have another meeting at 3, and I need to get there. So thank you very much.
Thank you for letting us let me speak today. So my name is Beau Robertson. I'm with Medtronic. I represent the cardiology division for this company and for Middle Tennessee and Eastern Tennessee. We do business with both Mountain States and Wellmont Health Systems. We have competitors with similar products that do the same thing. We have over 4,000 patients in that market. It's probably a little higher than that, but I'm trying to be conservative, who have medical devices that require frequent interrogation. And proximity to any facility is a real value. And the program we've seen so far from Wellmont on Mountain States looks like it will keep the most facilities open for the greatest amount of time. Under the current reimbursement system in healthcare today, we're still in a fee-for-service business. But as we move into global billing and global payments, the hospital is responsible for the status of that patient for a period of time. And so if our patients have to delay their ability to have medical care for even 30 minutes to an hour, it could change the total impact to that cost of care for the next 60 to 90 days. So we feel like there'll be some real value in keeping those facilities open. What we've talked about so far has been impressive, and we hope that you would support it.
Afternoon. I am Paige Kisber, and I represent the Hospital Alliance of Tennessee. We are an organization of Tennessee's not-for-profit hospitals that are speaking in support of the application for a Certificate of Public Advantage submitted by Mountain States Health Alliance and Wellmont Health System. There are several reasons why we think that the merger of these two health systems will best serve the patients and communities in which their hospitals are located. First, as not-for-profit hospital systems, Mountain States and Wellmont have a long-standing tradition of following a mission that enhances community and patient wellness and deliver care to all members of the community, regardless of their ability to pay. Several of their facilities are located in rural areas, offering an indispensable service by providing a significant amount of charity care and providing and serving a high percentage of TennCare and Medicare patients. Second, Mountain States and Wellmont specifically direct resources toward the community health improvement by conducting health needs assessments. Through this data-driven and collaborative process, the health systems partner with stakeholders in the community to identify and address the most significant health needs facing their primary service areas. In this application, they have pledged to invest at least $75 million in population health improvements over the next 10 years to meet the unique health needs of this region. Finally, and not-for-profit healthcare providers, Mountain States and Wellmont endeavor to be good stewards of the healthcare resources in their area. Their plan to invest in enhancing healthcare services, expanding access and choice, and expanding healthcare research and graduate medical education will ensure that cost-effective, high-quality, and accessible healthcare for the region will remain viable. Also, maintaining local governance protects patients and community benefits by keeping merger-related savings and jobs in those communities served by the healthcare systems. HAT urges Tennessee Department of Health to approve this application for a Certificate of Public Advantage. We are confident that the health systems and the state of Tennessee can work together to ensure the citizens of Tennessee receive the quality health care they deserve.
I'm Mike Harrison. I serve as the Executive Director of the Association of County Mayors. Obviously, I'm a former state representative. I've served the people from the 9th House District from 2003 to 2015. During the latter stages of my legislative career, I was pleased to sponsor the bill to update the statute pertaining to the Certificate of Public Advantage. This legislation, approved by both chambers and signed by Governor Haslam, enabled us to modernize this law to meet the health care needs of the state. I was pleased with the outcome of this bill because it provides an appropriate mechanism for the state to review a proposed merger to determine whether the benefits of a cooperative agreement outweigh by clear and convincing evidence any disadvantages attributable to the reduction in competition. And even if a COPA is granted, the state will still supervise the new organization afterward to ensure they comply with the provisions of the statute. Wellmont Health Systems and Mountain States Health Alliance are now proposing to merge through this law, and I share my enthusiastic support for their innovative and comprehensive COPA application. These two organizations closely followed the drafting of this updated law, understood its provisions, and produced a plan that will stand the test of time. In drafting their application for a COPA, Wellmont and Mountain States worked diligently to craft a proposal that would advance the quality of care for patients and the quality of life for the broader communities in Northeast Tennessee and Southwest Virginia. The two organizations have developed a vision to create a national model for healthcare quality, preserve regional access to services, and build new service offerings, reduce the pace of healthcare cost growth, and improve the health status of the communities they serve. They have crafted groundbreaking proposals to address major needs in mental health and addiction recovery, two pressing issues in the Northeast Tennessee region. Having served Northeast Tennessee in the legislature, I am pleased with the direction Wellmont and Mountain States are taking. They looked at the area's short-term and long-term needs and developed a thoughtful and fundamentally how to address them. When I sponsored the legislation to modernize the COPA statute, I was confident people throughout the state would be well served. Having seen what Wellmont and Mountain States have proposed, I can unequivocally say their application will achieve exactly what was intended. I encourage you to grant Wellmont and Mountain States a COPA so they can proceed with making a fundamental difference in the health and well-being of Northeast Tennessee. Thank you all.
Thank you, Commissioner Dreiser and Jeff, for allowing me to come speak today. I'm Kraig Becker, President of the Tennessee Hospital Association, and I really appreciate your time and the effort that's gone into this whole process. I know it's been a long and wearying one, perhaps, but one that's most important, particularly for the people of Northeast Tennessee. These are two of our members, Mountain States and Wellmont. They both belong to the Tennessee Hospital Association. And one of the things that I wanted to talk about a little bit today was that healthcare itself and hospital care in particular are really undergoing some transformation that have put tremendous pressures on these hospitals and others within our state. And I think what we're seeing is things that other industries have seen. I don't care whether you're talking about banking, airline, communications. It's the same thing. They've all seen the same market forces that are doing it, technology that's changing, particularly government oversight, which is forcing a lot of our hospitals to spend a lot of money, resources, and effort to keep afloat. And also, probably the last one is the increasing need for capital costs just to keep up with a lot of the technology that are out there. So what you do is when you put all these resources and you put all this into quite the stew, it leads to consolidation within these, and as we've seen in the other industries as well. So what I see here is that this is an effort to basically realize the economies of scale, and certainly the whole idea behind this is to preserve services to the people of Northeast Tennessee. Also, obviously, hospitals are not immune to all the forces that we're seeing, and they find themselves in a situation where consolidation certainly is a necessity and not just a market issue. The hospital business model is certainly changing, I think primarily because of the significant changes in the delivery of care as well. And lower reimbursement certainly doesn't help when it comes from our government and commercial payers. And you get coupled with the significant shift in focus of value over volume and greater demands to provide the highest quality of care to patients in a time of limited resources. So again, it's clear that these pressures are calling many hospitals and health systems such as Wellmont and Mountain States across the country to merge, or at least to partner so that they can ensure that they can continue to provide the care that certainly is expected. while it's true that these two systems could have gone with a different partner, but it seems to me that these two communities made the decision that they wanted this. The two communities made the decision that they wanted this to happen, this consolidation, and it was certainly what was best for their region. And I am a real strong believer in that the communities are the most important voices in these types of decisions. And in this case, the merging of the Wellmont Health Systems and Mountain States Health Alliance certainly are going to allow to keep healthcare local in Northeast Tennessee, and certainly to provide for those unique needs of the season. So certainly appreciate the opportunity to address this. I think what we are seeing here is something that's happening throughout the rest of the state. Certainly this is a unique opportunity, a unique situation. I think you'll probably see other consolidations going on throughout the state, but it's hard for me to fathom where that would happen, where we would need another situation of a COPA, but we will see. Time will tell. But anyway, thank you for your time, and we appreciate all of your efforts on our behalf.